9 MPs and 4 senators are among thousands of Kenyans being treated for cancer in Indian hospitals, a legislator who was successfully treated for brain cancer says. The identity of the MPs cannot be revealed, but most of them are booked at Apollo Hospital outlets in New Delhi and other cities in the country. Juja MP Francis Muni Uwaitatu, popularly known as Waka P, returned home on Friday after successful treatment for brain cancer. Waitatu stayed in India for 7 weeks. He interacted with senior Kenyan government officials and well-known businessmen being treated for cancer in India. Waitatu said most of the public figures are suffering secretly and cannot seek treatment in Kenya, partly because of the stigma associated with advanced chronic diseases. So many people are suffering in silence from cancer. Nobody wants to talk about it because of the stigma behind it. In India, I met hundreds of cancer patients from Kenya alone. Among them were 9 of my fellow MPs and 4 senators. The cancer scourge is enormous and we can no longer afford to bury our heads in the sand. We must get out and talk about it, he said. Approximately 10,000 Kenyans travel abroad every year in search of treatment and end up spending at least $10 billion in the same period, according to the Ministry of Health. Waitatu also disclosed thousands of Kenyans who were taken to India for treatment, and their caregivers, are sleeping in the streets after running out of money. He met many of them because there is an existing network of sick Kenyans in India. Those people you have been helping in fundraising to go for further treatment in India cannot find anywhere to lay down their heads. They are sleeping in trenches because they cannot afford renting the expensive houses in India, said Waitatu. I personally spent $1.8 million on housing alone for the period I was there. How many Kenyans can afford that? He said. Yesterday, West FM journalist Dennis Amondi, who was admitted at an Indian hospital with leukemia, appealed for help, saying treatment was stopped a week ago after he ran out of money. About 40,000 Kenyans are diagnosed with cancer annually, and the disease kills about 15,000 people every year, according to the Kenya National Bureau of Statistics. The Juja MP also said there was a need for prominent Kenyans to declare their cancer status to fight stigma. If they could have come out openly like myself, a solution would have been realized so far, he said. A 2015 survey by the Ministry of Health found that 40% of Kenyans who traveled overseas for treatment had renal, kidney, diseases. At least 21.2% had cancer, 11.8% had a spinal disease, 5.6% had joint and bone diseases, 1.9% had connective tissue disorders, while 1.6% had peripheral vascular disorders. The patients said they chose to go abroad because of lack of enough specialists and specialized medical equipment, long waiting periods, especially for cancer treatment and kidney transplants, and the high cost of treatment in Kenya. Mary Wangai, from the Standards and Quality Assurance Department at the Ministry of Health, said patients seeking treatment outside the country currently require approval from the government.